Today, I want to talk about one of the most important medications across all of cardiology, and it might surprise you to know that this medication is over the counter nationwide. Today, on this inaugural episode of Medication of the Month, let's talk about all things acetyl salicylic acid, also known as aspirin. Welcome back, everyone. If this is the first video of mine that you're seeing, my name is Ricky. I am a board-certified cardiology pharmacist with almost 3 years of experience in a hospital setting. Each month, I will select a core medication used to treat a variety of cardiovascular diseases and provide an easy to understand yet detailed overview of how we use this medication, how it works, how it's dosed, and things to look out for so that you can be prepared if either yourself or a loved one is on this medication long term. Of all the medications I manage, there is probably none more abundant and commonplace than aspirin. First synthesized in 1899 by scientists at the Bayer Company and marketed as a pain reducer and fever reducer, aspirin quickly gained popularity through the early part of the 20th century. In the 1960s through the 1980s, scientists finally were able to figure out the mechanism of action of aspirin and its demonstrated antiplatelet effects, which led to aspirin being commonly used for the treatment of a variety of cardiovascular conditions. Fast forward to the present day, and aspirin use is recommended by multiple national consensus organizations, such as the American Heart Association, the American College of Cardiology, and the American Diabetes Association to prevent both first occurrences and recurrences of myocardial infarctions, otherwise known as acute coronary syndromes or heart attacks, as well as certain types of strokes, such as ischemic strokes. Getting into the details of aspirin, let's start with the basic scientific naming and mechanism of action. Although commonly known by its trade name of Bayer aspirin or just aspirin, the active ingredient is technically acetyl salicylic acid. Now, salicylates are actually derived from the bark of the willow tree and have been used for thousands of years, dating back all the way to the times of the ancient Sumerians as a way to treat pain and reduce fever. Salicylic acid itself is an extremely bitter compound, and so scientists were tasked with trying to come up with a more palatable version of a salicylate that could actually be consumed by humans. And thus, through various scientific processes, acetyl salicylic acid, also known as aspirin, was born. Now, mechanistically, aspirin works as a cyclooxygenase 1 and cyclooxygenase 2 enzyme inhibitor in multiple different areas of the body. And depending on which area of the body we're talking about, we will see different effects. So starting in platelets, cyclooxygenase 1 is an enzyme that naturally helps to produce a substance called thromboxane A2. All you need to know about thromboxane A2 is that it activates your platelets and helps them to clot. When we give aspirin and inhibit cyclooxygenase 1, we decrease the production of thromboxane A2 in platelets, which gives us a natural antiplatelet effect. In the stomach and the GI tract, we also have cyclooxygenase 1, and normally it helps to produce what we call gastroprotective prostaglandin I2, basically a type of substance that helps you maintain healthy cells throughout your GI tract. And in inhibiting cyclooxygenase 1 throughout the GI tract, aspirin theoretically can actually increase the risk for stomach and other types of gastric injury or even bleeding. Finally, throughout the body, aspirin can also decrease the activity of cyclooxygenase 2, which is known to produce pro-inflammatory prostaglandin E2. So by inhibiting cyclooxygenase 2, aspirin can give you a natural anti-fever and anti-pain effect. It is also important to remember that aspirin is an irreversible inhibitor of cyclooxygenase 1, particularly in your platelets. What this means is that if you take a single dose of aspirin, that aspirin will bind to cyclooxygenase 1 for the entirety of that platelet's lifespan, which is usually about 7 days. Moving on to the different types of dosage forms that are available for aspirin, not surprisingly, there's a multitude of different types of products that you can buy. The most common dosage forms, which are typically available over the counter, are either the immediate release or chewable formulations or an enteric-coated tablet. The most common doses that you'll see are 81 milligrams once a day. That is the lowest dose, also known as baby aspirin, all the way up to 325 milligrams. This is commonly referred to as full dose aspirin. It has been shown in scientific studies that the lowest dose, or 81 milligrams, predominantly inhibits cyclooxygenase 1 in platelets, leading to more of a blood thinning effect, whereas the higher dose of 325 milligrams can inhibit both cyclooxygenase 1 and cyclooxygenase 2, giving you a blood thinning effect, but also a pain reducer and fever reducing type effect. Moving on to how we typically use this medication. In the cardiology world, we typically will use aspirin to either prevent a first occurrence, so this is called primary prevention, or a second occurrence, or secondary prevention of certain types of thrombotic events. So these are typically acute coronary syndromes, which is a heart attack, ischemic strokes, or certain types of plaque buildup that are in your lower extremities, like in your legs, and this is called peripheral artery disease. Additionally, aspirin is used after people have cardiac stents placed in their heart vessels to make sure that those stents stay open and prevent any clotting from occurring within them. The most commonly used dose of aspirin throughout all of cardiology and most of those indications I just mentioned is 81 milligrams by mouth once a day, or taking a baby aspirin once a day. Now, in an emergency situation where there is a concern for a heart attack, you may be instructed to take 325 milligrams of aspirin, which is in essence the same as taking 4 81 milligram tablets. It is extremely crucial, and if you remember one thing from this video, it's this. It's extremely crucial that if you're in that situation that you chew the aspirin tablets instead of swallowing them whole. This is recommended so that the aspirin gets absorbed and starts working in your body as soon as possible. Because with a heart attack, you are literally having dying heart cells, and we want to prevent that from getting worse as soon as possible. The reason we chew them is because the enteric-coated products, which you might see termed aspirin EC over the counter, take about 2 to 4 hours to really get peak absorption in the body if you swallow them whole. However, if you chew the enteric-coated capsules, you basically negate the effects of that coating and you allow the aspirin to work much more quickly. And again, time is heart when it comes to heart attacks. You might be asking, why do they make enteric-coated capsules? Well, we mentioned how aspirin can inhibit cyclooxygenase 1 in the GI tract, and this can decrease the production of protective prostaglandin I2. And the whole concept of the enteric-coated capsule was kind of bypass some of the mechanisms we see of aspirin absorption throughout the stomach and GI tract, and to be a little bit more gentle on the stomach and maybe reduce the risk of bleeding. However, there's been multiple studies done that have compared the immediate release chewable aspirin with enteric-coated, and they both have similar rates of gastrointestinal bleeding. So, of course, in consultation with your doctor, if you're kind of on the fence of which one to use, I would recommend the immediate release chewable formulation. In terms of side effects, the main side effect of aspirin, as we've talked about a lot so far today, is gastrointestinal bleeding. It could be other types of bleeding as well, but the GI tract is the most common place you'll see this. In addition, in very young children that are just getting over a viral illness, either the chickenpox or influenza, you actually want to avoid giving aspirin because of a theoretical risk of something called Reye's syndrome. In terms of availability, aspirin is available over the counter or by prescription in the United States, and it is very cheap and affordable either through insurance or if you're paying a cash price. This is really important for access because in many indications in cardiology, aspirin may be continued lifelong after you've had a heart attack or after you've had a stent placed, for example. So it's really important that you always have access to this medication, and this is certainly one of the easier ones to get hold of. Okay, so I know we discussed a lot of useful information about aspirin today, but to keep things simple and to make sure you remember some take-home points, I want to reiterate the following 3 things. Number 1, remember aspirin works by inhibiting cyclooxygenase 1 and 2 enzymes, decreasing the production of thromboxane A2, which decreases your platelet activity and naturally has a blood thinning effect. It also decreases production of prostaglandin I2, which might increase your risk of gastrointestinal side effects and bleeding, and then it inhibits the production of pro-inflammatory prostaglandin E2, which has a natural anti-fever and pain-reducing effect. Number 2, in cardiology, aspirin is typically dosed at 81 milligrams once a day. This is also known as a baby aspirin dose, and we use it for either primary or secondary prevention or for people with cardiac stents. And then number 3, remember in emergency situations where you are instructed to take aspirin, please be sure to chew the tablets and do not swallow them whole so that they get activated and start working as soon as possible. That's all I had planned for today, so I hope you're able to learn something new from this video, and if you did, please be sure to like and leave a comment with any questions or thoughts that you have. Additionally, if you haven't already, please be sure to subscribe to my channel for more simple videos like this. Thanks again so much for watching, and I'll see you next time. Bye-bye.